she's saying she lost her baby
At 35?
35 weeks. I think it was a stillbirth. And she normally meets her husband on, I think, 3 months in a year. I think the husband could be working from far. But up to now, she has failed to conceive. That is since 2021. Those are very many years, really. Yes, and she's 34 years old.
Yeah, sorry for that pregnancy loss. Yeah, well, the cause of the pregnancy loss, that was a very big pregnancy. I think at the time of the pregnancy loss, there could have been some events, and they could analyze those to find out what could have caused that pregnancy loss, since it was a stillbirth. But to her problem of delaying to conceive in this time, there could be a number of factors. One of them could be infrequent meeting. That one of 3 months only in a whole year is very little. But she needs to be evaluated, because these are now many years. Her tubes have to be checked. She's 34, but of course we've seen some people at 34, their hormones are not okay. Her hormones have to be checked. The tube hormones and her womb needs to be checked. But also her husband's sperms have to be checked. But the other good thing now is that for couples where they are not able to meet frequently, we are now able to have storage of the sperm for the man, and then you can do insemination, artificial insemination, and it works very well. So that's the good news. But first we have to check.
Analyze this
Yes,
condition.
we need to check her properly and check the husband. And the husband can come and leave the sperm. And you know, this is how the world is now. People are running around to try and make ends meet. But it's possible to do insemination.
Thank you. Thanks so much, Doctor. I think you've got all the feedback from Doctor. Good evening, Doctor. What do you have to say about taking folic acid when I'm planning to conceive? Does it help? Does it help? Does it help? Something like that. Then another one saying, good evening, Bethany TV. If one has a thick uterus and cannot conceive, do you have a remedy at Bethany Hospital?
So those are two questions.
Two questions,
First is about
talk about folic acid. Yes.
Yeah, I want to thank the person who raised that question of the folic acid. You know, folic acid is a very simple medication, readily available everywhere. There's a lot of evidence which shows that actually taking folic acid as one of the pre-pregnancy, prenatal medications before somebody gets pregnant improves, one, the chance of getting pregnant, and also it improves the outcome. Yes.
Wow, that is very good. Yeah. I've learned that also. Yes. And then a thick uterus?
Yeah, thick uterus, well, there are different causes of thick uterus. Now, the management will depend on the cause. So that has to be evaluated. The thick uterus, we need a scan to evaluate what is causing the thick uterus. Is it adenomyosis? Is it fibroids? Or is it just overtly thickened wall of the uterus? Most of these do have treatment, but the success of the treatment depends on the type. Yeah, so she needs those to be evaluated, the thickened uterus to be evaluated.
Good evening, Doctor. Good evening, Doctor. This is Sarah. I got a miscarriage 2 times and they cleaned me with those medical metals inside. Does it mean I have scars? And what could be the signs when someone has scars on the uterus? This is Sarah.
Oh, yeah. So from her description, it looks like she underwent care from, she was cared for by qualified health workers. If that is the case, she should not worry so much. If the last miscarriage was not very far, she could give herself about 6 months and then try to conceive. Yeah, the issue here is, was it done properly? And also a follow-up can be done. But she can look at her period and see whether her periods are scanty or they are the normal flow or they are too much. So those will guide. But if she has any worries, then she needs to be evaluated.
Thank you, Doctor. Yeah. Apopia from Chiwature is saying every morning she gets problem of having a stone. She feels like, I think, a stone in the stomach, and she has spent like 5 months. It disturbs her a lot. What could it be? Yes, some painful, hard kind of substance. Yes.
Yeah, so I think what she's describing is feeling a sensation of a mass in the lower abdomen, which is feeling like a stone. One of the commonest causes there could be a fibroid, like the fibroid which is on the outside of the womb.
When you have a fibroid, doctor, do you feel it that it's hard enough?
If it's big.
Oh, okay.
If it's big, you can feel it.
Okay.
Yeah, if it's big, you can actually feel it.
Thank you.
Yeah, it could be a fibroid, or it could even be a cyst. So she definitely needs, that's not a normal feeling. It has to be
dealt with.
Yeah.
Thank you. And she's saying, where do we find this good doctor? You can find Dr. at Bethan Women's Hospital in Luzira.